Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. Assalamu alaikum. My name is Mavia Hassan and my roll number is BB1650217. Final Prof Morning, and my title is Immunoglobulin. What is immunoglobulin? It's a concentrate of antibodies of human plasma used to increase immunity to some viral infections, like hepatitis, measles, and rubella. It increases the natural immune response in person with compromised immune system. जिन पेशेंट्स में इम्यूनिटी कम होती है, डेफिशिएंसी होती है उनमें, तो उनको इम्यूनोग्लोबुलिन की जो है वैक्सीन दी जाती है ताकि उनका जो इम्यून सिस्टम है वो बूस्ट करे। व्हाट आर द इंडिकेशंस, यानी कि किन डिजीजेस में जनरली यूज होती है। पहली हमारे पास इम्यूनोडेफिशिएंसीज। It's a state in which immune system ability to fight infectious diseases and cancer is entirely absent. For example, in diabetes, WBCs don't function well when blood sugar level is high. Second one is Kawasaki disease. It is a syndrome of unknown cause results in a fever affecting the children under 5 years of age. Blood vessels are inflamed throughout the body. Third one, immune thrombocytopenia purpura. It's a blood disorder in which the number of platelets are decreased. It causes bruising, bleeding gums, and internal bleeding. Fourth, acute immune polyneuropathy. It's an autoimmune process characterized by weakness and mild sensory changes. Fifth one, chronic inflammatory demyelinating polyneuropathy. It is a neurological disorder, inflammation of nerve roots and peripheral nerves, and destruction of fatty protective covering, that is myelin sheath of nerve fibers. What are contraindications? Immunoglobulins are contraindicated in person having isolated immunoglobulin A deficiency, because such persons have the potential for developing antibodies to immunoglobulin A and could have anaphylactic shocks to subsequent administration to blood products that contain IgA. It should not be administered to patients who have severe thrombocytopenia or any other coagulation disorder that would contraindicate intramuscular injection. What are adverse effects? Pyrexia, weak fever, chills, current nausea, vomiting, face flushing, headache, fatigue, malaise, anaphylaxis, यानी कि एलर्जी भी हो सकती है। What are interactions? Immunoglobulin interact with live vaccines, especially MMR. Active immunization should be postponed until 3 months after last administration of immunoglobulin. यानी कि जब आपने कोई भी वायरस वैक्सीन दी है पेशेंट को, उसके आप 3 वीक्स तक आप उसके जो एडवर्स इफेक्ट्स हैं, उसका जो रिस्पॉन्स है उस वैक्सीन का आप चेक करेंगे, उसके बाद ही इम्यूनोग्लोबुलिन को एडमिनिस्टर करेंगे उसमें, ताकि कोई इंटरेक्शन ना प्रोड्यूस हो ऐसा जिससे वो टॉक्सिसिटी प्रोड्यूस कर सके। डोजिंग, adult dose is 200 to 400 milligram per kilogram IV. Neonatal dose is 4 milligram per kilogram for early IV. Pediatric dose is 100 to 200 milligram intramuscularly. Dose adjustment. In replacement therapy in primary immunodeficiencies in pregnant lady, dose starts from 0.4 to 0.8 gram. Thereafter, 0.2 to 0.8 gram every 2 to 4 weeks to obtain immunoglobulin G trough level 4 to 6 gram per liter. Dosage forms, indications. First one is subcutaneous form is used in neuropathy polymyositis, and the second one is myasthenia gravis, and the IV form is used in myocarditis and in autoimmune uveitis. Now, pharmaconomics, brands and low price and high price. Biavin injection, 1050 rupees 10 ml, and the high price has the 3,450 40 liter 401 ml। पेंटाग्लोबिन में एक बोतल में जो है वो 10 ml होता है और इसकी प्राइस है लो प्राइस जो है वो 5,500 की है और 1 एम्प्यूल में 10 ml है और हाई प्राइस मेरी है 8,500 और जो ऑक्टाग्राम है 1 वाइल उसकी 50 ml की होती है और प्राइस इसकी 3,950 और जो 20 ml की वाइल है हाई प्राइस में 48,875 rupees। What are the alternatives? Lymphoglobulin, pentaglobulin, IV cameras as such के immunoglobulin के alternatives मौजूद नहीं है क्योंकि इम्यून डेफिशिएंसी सिंड्रोम्स के लिए जो है इम्यूनोग्लोबुलिन ही रिकमेंड किया जाता है। उसके ब्रांड्स के अल्टरनेटिव है और टॉक्सिसिटीज क्या है इसकी ब्लड प्रेशर चेंज हो जाता है टैकीकार्डिया एक्यूट रिनल फेलियर एसेप्टिक मेनिंजाइटिस एक्यूट एनाफाइलेक्टिक इंजेक्शंस अगर ओवरडोज में दे दिए। Rational use, irrational use, rational use. Immunoglobulins are used rationally to treat kidney transplant with high antibody recipient IVIG 2 gram per kilogram dose. Second one, hemolytic anemia, IVIG 0.4 gram per kilogram per day for 5 days. And in alloimmune thrombocytopenia, 1 to 9 gram, etc. Irrational uses IV immunoglobulin in pediatric hematology, Alzheimer's disease immunotherapy, treatment of immunologic abortion, therapeutic trial of intracerebral human tetanus। अल्जाइमर डिजीज के लिए इसकी थेरेपी की गई थी तो स्टार्टिंग में इसके जो है इफेक्ट्स बहुत अच्छे प्रोड्यूस हो रहे थे लेकिन उसमें एडवर्स इफेक्ट्स प्रोड्यूस होना शुरू हो गए थे और वो टॉक्सिक हो गए थे पेशेंट के लिए। Now come towards the case study. A severely undernourished 4-year-old girl is referred to the pediatric outpatient clinic for recurrent anemia and arithmetic expression of face and tongue and accompanying hepatosplenomegaly. At age of 2, she admitted to hospital for respiratory tract infection and then investigated for TB, EBV, toxoplasmosis, rubella, cytomegalovirus, herpes, hepatitis B, and HIV. And she got positive result for EBV and IgG. The child was falling to 5, fall below the fifth centile for height and weight. What could the treatment goal of therapy? Top notes. Subject: 4-year-old girl having recurrent anemia, arthritis present from hepatitis B megaly, no surgical history, no TB family, no travel history, and not on medications and no allergies. Weight 8.3 kilogram, height 75 centimeter, blood pressure and heart rate are normal, no jaundice, no dehydration, no stigmata of HIV. Head and neck, puffy eyelids, erythematous flesh with mild induration on face, forehead and tongue. Abdomen distended, stretch marks, soft vibration, large spleen, bowel sounds heard on auscultation. Objective में लैब रिजल्ट्स जो हैं इसके टोटल प्रोटीन एल्ब्यूमिन बिलिरुबिन एएलटी एएसटी आईजीजी आईजीए आईजीएम हीमोग्लोबिन लेवल बहुत कम है 5.4 न्यूट्रोफिल्स एचआईवी नेगेटिव है पार्वोवायरस फ्रॉम बोन मैरो एस्पिरेट पॉजिटिव है gamma GD WCC and smart cells assessment differential diagnosis HIV TB fever pneumonia cystic fibrosis and she diagnosed mainly for severe combined immunodeficiency disease. The case explores the clinical manifestation of primary immunodeficiency type of SCID, which is a life-threatening syndrome of recurrent infections, diarrhea, skin infections leading to severe T and B cell dysfunction and affect natural killer cells. Now, this is a plan. We will discuss treatment. Patient transfused with packed blood such as with severe anemia. IV immunoglobulin prophylaxis polygamy was given during admission. Bone marrow transplantation for this extreme care to match the HLA of the donor with host, but mismatched donor transplantation can be considered. This approach is successful if the disease is diagnosed with first 3.5 months of their life. No BCG vaccine should be administered to patients with this kid prior to bone marrow transplantation. यानी कि जो टीपी की वैक्सीन है बीसीजी उसको एडमिनिस्टर नहीं करना पेशेंट में जिसको सीवियर कंबाइंड इम्यूनोडेफिशिएंसी सिंड्रोम है और उसको बोन मैरो ट्रांसप्लांट कर दिया गया फिर आफ्टर दिस गिव इंट्रावेनस immunoglobulin so that antibody levels are restored until the B cell system is restored with transplantation. However, long-term use will change the terminal course of SLID. The patient is given the drug Gamacort subcutaneously in a dose of 1 milligram per kilogram IV or 2 ml per kilogram 1 hour. Note: the child is aware of the side effects associated with Gamacort. His allergic reactions can rise, decrease, tardiness, fever, etc. If the patient develops several IgA deficient and stop dosing, minimize the patient's stress, take plenty of sleep to boost the immunity. Healthy diet is recommended. She is recommended to come to hospital for regular checkup and her doctor's symptoms. These are the references I have taken material from clinical microbiology, young and adult pharmacology, basic and clinical pharmacology, medicine and literature for medicine. Thank you so much.